There are three key themes running throughout the course. The first one is co-production or assets approach. And that is that we all have our own assets that we can use and share with others. That includes our patients and clients and relatives and carers. We'll develop this theme of co-production in the way that we share our learning and learn from each other too. Secondly, we'll be looking at developing ourselves and others. By reflecting on ourselves, our patients and clients, and staff and colleagues, we'll explore some of the contemporary frameworks which help us to build relationships and provide you with tools and resources to develop your communication skills. The third theme running through the course is stories and metaphors. We'll use stories throughout the course to strengthen learning and encourage reflection. Stories will be from patients, from relatives and carers, and you'll also be encouraged to use your own. This is a story from a care home about a resident called George, who was asked, "What can we do to make your time here special, George? What would you wish for?" George had been a keen footballer all his life and supported the local club. So he said, "I'd really like to go to the football game." So the staff made the arrangements, and it was going to be quite difficult because of his mobility problems. As the day came closer, George was unable to go to the football game. But the staff said, "What were you most looking forward to?" And he replied, "A Scotch pie at half-time." So staff went to the local baker and they bought him a pie which he enjoyed in the comfort of the home. So this is an example of how a story can really illustrate the importance of really listening and asking good questions to understand other people's perspectives, and of course make a difference to the care of people like George. This course will explore and examine the many facets of relationship-based care, including some of the contemporary theories such as emotional labour, taught by Professor Pam Smith here at the University of Edinburgh. We'll also highlight the census framework developed by Professor Mike Nolan at the University of Sheffield, and also look at caring conversations, a tool developed by Professor Belinda Dewar at the University of the West of Scotland. My particular expertise relates to feedback and complaints in my work with the Scottish Public Services Ombudsman. I'll be sharing with you my work on the power of apology and how we can really encourage our patients and clients to use feedback, both positive and negative, to improve healthcare across the board.
This production is brought to you by the University of Edinburgh.